Hi, this is Manjiri for the Yogique. In our prenatal series, this is a segment on hip openers, lower back expansion and side stretches. So to begin, you may want to place a block under the seat, and I like to use that block in order to keep my pelvic rim leveled and then have my knees lower down to the floor. And then I want to bring my feet together. And I personally don't use the block, but I always recommend if it's needed. First, we want to work on just opening the ankles and the feet and the inner thighs and the groin. So you want to open the feet as if you're opening a book, trying to bring the tops of the feet on the mat. And then I want to close the feet and then bring the knees up towards the shoulders. So really contracting the inner thigh and extending the back. Once again, open and then drop the knees towards the floor and then close. And then from here you want to repeat that maybe like 4 to 5 times. And then you want to wrap the fingers around the toes. So really keeping the bottoms of the feet close together and drop the knees towards the floor. Roll the pelvis so you have that anterior tilt. Broaden the chest. Roll the shoulders back. Inhale. On exhale, hinge at the hip crease and then keep expanding the lower back. And if you're coming just maybe 30 degrees and you feel that expansion in your lower back, that's where you want to be. Keep dropping the knees towards the floor so you have that extension in your inner thighs. I like to go all the way, but I don't like to insist on it. But as long as I have my breath, I can drop down all the way. Keep the shoulder blades away from the ears. Neck is nice and long. And then on the inhale, I want to come back up, feeling very introspective. I'm ready to go on the chest expansion, come back bend, which is strengthening for the lower body as well as the upper body. Because after the baby comes out, you will be carrying the strollers and the baby bags, the diapers, the car seats, all kinds of things. So it's important that you have upper body strength. So I want to place my hands behind, fingers facing back and the thumbs out. And I want to shift the weight just halfway into my arms. So my legs and my arms are doing equal amount of work. Roll the chest open, push the feet into the mat, and then come up all the way, lifting the pelvis as high as you can, while dropping the knees towards the floor. And then stay here for a couple of cycles of breath. If it gets too much, always feel free to come down whenever you want to. And then come down very gently, very gradually, very mindfully. And when you're all the way down, you want to move your feet a little out, but still close together, so you have more of a diamond shape. And then you can have your hands anywhere along the shins. They can be near the ankles or halfway or on your knees. Again, roll the chest open, or you can even bring the thumbs at the hip crease, so you're really aware of that inflection point. Broaden the chest. Inhale. Once again, hinging at the hip crease, fold forward. Very different experience than the previous forward bend. And then again, come down to any extent, keeping your shoulders back. And again, on the inhale, come up all the way. And now we are going to do the side bend. So you want to fold your right foot in, bring the knee down. If you want, you can have another block to support that knee. And then extend the left leg out as you can to really feel the length along the inside of that leg. And then flex that foot to stretch the back of the leg. And then wrap your right arm around your waist. So you're rotating the right side out and then start walking the left hand towards the foot If it doesn't go all the way, you can just stay wherever it feels good for you. You're elongating from the outer hip, along the spine, along the shoulder. And you're also broadening and opening the chest. If you're comfortable here, then you can go all the way, bring that foot into your hand, and then sweep that right arm all the way over, and then grab the foot. And then again, rotate and take your gaze towards the sky. And then taking the gaze towards the floor, bring the hands down, and then inhale, come back all the way. Always work with your breath, and when you're a mom-to-be, work with your baby. Don't overstress the baby. Enjoy the pose whenever you can. Prepare to go on the other side when you're ready. Thank you for watching. Stay tuned. There is a lot more to come on the Yogi.